Welcome to a very special happy hour. I'm Cody Willard. Eric's on assignment tonight. He's back, I do believe. And
I'm Tracy Burns in for Rebecca Diamond. Now, amid all the town hall chaos, we're calling a truce, and we're holding our own town hall meeting on health care.
If you thought the town halls were going to get easier for our House lawmakers on recess,
think again.
That was the scene yesterday in Michigan during a town hall held by Democratic Congressman John Dingell.
Now, these town halls have gotten out of control with pushing and shoving and face-to-face encounters and acquisitions flying at both sides.
And exactly where's the money coming from? Is it coming out of my paycheck? I want to know if it's coming out of my paycheck. Yes or no?
Under the Obama health care plan, which you support, this man would be given no care whatsoever because he is a cerebral palsy handicapped person.
We put an amendment in which will address his specific problem as the bill was going through.
No.
This meeting has been rather heavily infiltrated by folks who wish to make trouble, as you all saw. And they were very diligent and effective at the matter.
Guys, I can guarantee you this. There are no infiltrators here in the, well, I hope so, in the special happy hour town hall meeting on health care. I'm making it clear off the top, though. If you're turning in for a drunken brawl because we're in a bar talking to town hall, well, you're going to be sorely disappointed.
Yeah, because one, we don't drink. And two, we're taking questions from folks here in this bar, and we're using your emails. So let's introduce the real host for this hour, the folks both you and I will be questioning.
Indeed. Welcome to Democratic Congressman Dennis Kucinich. He's a happy hour regular, and he's out in his home state of Ohio.
Yeah, it's so great to have him here. And Dr. Mark Siegel, Fox News medical contributor, and joining us shortly, Representative Pete Hoekstra, Republican from Michigan, as well as Dr. Erica Schwartz, Chief Medical Officer at Synergy Health. All right, Congressman Kucinich, let's start with you. Tell us, what is your real reaction to these town halls so far?
I did a 3.5-hour electronic town hall meeting on a Cleveland radio station, WTAM. People have questions. They want to know. There's been a lot of misinformation out there. For example, one of the biggest ones is there's going to be a government-run healthcare system. The government's not taking over the hospitals. Now, I haven't said that I'm supporting H.R. 3200. I have some questions of my own. But we have to dispel the myths that are surrounding it. And one is that somehow the government's going to take over all the hospitals and all the doctors and all the health care in the country. And that's just not what this bill is about.
Congressman, thank you. Congressman Hoekstra, how about your reaction?
Well, I think it's great that they're having these town hall meetings. I mean, get out and talk to the people in their districts, hear what the folks back home have to say. And, you know, I think Dennis has brought it up. I think this really is a debate about whether you're going to be controlling your health care or whether the government's going to be controlling your health care. They're not going to be running the hospitals, but they're going to be paying the hospitals. They're going to be telling the docs what they can and cannot do. It's a fundamental question about personal rights and freedoms.
Dr. Siegel,
yeah, I would
off that. What's the difference between what we see right now and what the future would hold, even under the Republican changes to what might be coming out of the Democratic platform?
No, exactly, Cody. And by the way, I have a lot of respect for Representative Kucinich, but I want to say I don't think anyone is actually the government is taking over anything. That's a spin. I think the issue is if the government is applying more force to the situation, if they're going to become more involved, if they're going to have more oversight, what effect is that going to have if the government in the past hasn't done such a great job with Medicare? If Medicare is not cost effective, if doctors have seen reimbursements cut, if there's a shortage of primary care physicians in the United States, who's going to do preventive medicine? If insurance itself is out of control, how is the government's increased involvement? And I have read H.R. 3200, and I see a lot of government oversight being suggested here. It's a spin, and this is with all due respect to the congressman, because I think he's a really great guy and very smart. But it's a spin to say the government's taken over.
Guys, we got a whole lot more of exactly
but when
that
you say
on
Medicare,
just
do you
one
want to
second,
talk about Medicare?
Congressman, we're going to get right into it. Just 1 minute, though. I also want to get everybody else involved, too, guys. The Senate is now on recess after working for much of the week on their health care bill.
And before the House went on recess, a key committee reached a deal with those blue dog Democrats. Those are the Democrats that are not so into what the Democratic Party is doing. Though we don't know a lot about what's in this deal.
Yeah, nice not knowing much, huh? Rich Edson is going to walk us through, though, what we need to know and what we know now about what the government is planning with health care reform.
Yeah, hey, good afternoon, guys. And what we're looking at here, and before we get into all this, we have to remember one thing. This is one committee that is probably going to get back to work writing this bill, one committee of 3 in the House, and there are 2 more committees in the Senate that are considering this. We have a long way to go. And what they've decided essentially is that the deal that they struck is that the tax exemption for the businesses that would have to either provide health care or get a tax penalty, it's now $500,000. It was $250,000. There will be a public insurance plan. Now, this is what a lot of folks were talking about, government control. We heard a lot about this just a couple of minutes ago. What the key difference, I think, what you're seeing now in the House, what possibly may emerge in the Senate, is that the compromise bill does have a publicly run insurance plan. It will compete with the private insurance plans. The goal here is to try to get higher quality care. That's what many of the folks are saying, that would drive costs down from the private insurers. But the public plan is getting a lot of criticism here, essentially because folks are saying, look, what you're going to do is you're going to have a government-run plan. There's no way the private insurers could compete with that. And eventually you get your way into a single-payer system where the public plan is the only plan. Guys?
So this is really just kind of moving us all into this single-payer plan. How are they going to pay for this? I mean, this employer tax deduction is not going to make a dent.
There are some Medicare cost savings that they're also taking a look at. I mean, there's a long list of different pay-fors that folks on both sides of Congress are looking at right now. Another would be a tax on those Cadillac plans, as they're called. An insurance company would have to pay a tax if they offered insurance plans over, I believe, $20,000 or $25,000. They're looking at that personal tax for millionaires or folks and families making over $1 million a year. There's a whole different group, and of course, that's the key issue right here. Who's going to have to pay for all of this?
Thank you so much, Rich. Representative Kucinich, I know you wanted to get some words in there. I think we're still on topic. Why don't you go ahead and set us up? What were you going to rebuttal over there?
Well, a few things to keep in mind. Medicare was deliberately run into the ground by those who wanted to destroy it by giving the pharmaceutical companies no controls on the cost of their drugs that they were charging Medicare for, and also the Medicare Advantage plan that was jacking up the cost to Medicare. Also, this plan is not leading towards single payer. I wish it was, because I don't think the insurance companies, the for-profit insurance companies, have a legitimate role in health care in America when it comes to primary care and assuring our population has the care they need. People can't afford health care. 46 million Americans uninsured, another 50 million underinsured. People are going broke with this system, and that's the real crux of this matter. This is really a fight between the private insurers who want to keep their $800 billion a year in revenue and the rest of us who are trying to struggle to get health care.
Representative Hoekstra, though, if we could talk about this a little, because we got $60 billion in fraud already in Medicare. Do we want to recreate this all over again? And the 47 million uninsured, it's a little deceiving because a lot of those people have insurance accessible. They turn it down. We have illegal immigrants included in this number. So with net, we get down to it. We're talking about 14 million people uninsured and a system that's already full of fraud.
If you recreate Medicare and Medicaid, hospitals will go out of business. They'll tell you that the worst payers today, when people coming through the door, are Medicare and Medicaid. Medicare, you give $1 of care, the hospitals and the docs get about 60 cents back. Medicaid, it's about 40 cents on the dollar. What you're happening right now is in Michigan, people are going into docs and they say we're going to be paid we're using Medicaid. They're being turned away. And this will lead to single-payer system. We've just seen it in student loans. In 1993, the government said we're going to offer a public option for college student loans. Last month, President Obama said we're going to offer only one. We're not going to provide any help to private sector student loans. It's all going to go through the government because the government's cheaper and they can do it better. The same thing's going to happen here with health care.
Same thing happened with Fannie Mae and Freddie. Hold on a second, if I could, Dr. Siegel. We've got someone from